Pruritus or itching is an unpleasant sensation on the skin that provokes the desire to rub or scratch the area. Itching can cause discomfort and even frustration. In severe cases, it can lead to disturbed sleep, anxiety, and depression. Constant scratching to obtain relief can damage the skin and reduce its effectiveness as a major protective barrier. Treatment of pruritus must address the underlying condition. Diagnosis, therefore, needs to be made for effective treatment. Causes: localized pruritus, that's confined to a certain part of the body. Main causes are seborrheic dermatitis, pruritus vulvi, anogenital pruritus, as anogenital pruritus, tinea infections, gravitational eczema, and lichen simplex chronicus or lichen simplex chronicus. Pruritic skin disorders due to a primary skin disease. The main causes are atopic eczema, dry skin, allergic contact dermatitis, urticaria, scabies, prurigo or prurigo, miliaria, as heat rash, pediculosis, insect bites, dermatitis, herpetiformis, as well lichen planus or lichen planus, and bullous pemphigoid. For generalized pruritus, usually due to a systemic disease, the main causes are hematological, like iron deficiency, anemia, polycythemia rubra, vera, and also lymphomas, leukemias. Unlinked diseases like intrahepatic or extrahepatic cholestasis, primary biliary cirrhosis, and hepatitis. Chronic kidney disease, thyroid disease, pregnancy, diabetes mellitus, carcinomas, drug reaction, onchocerciasis, and it could be psychogenic too. The symptoms are itching, scratching. Signs that are usually elicited are excoriation and lichenification, scars, and also features of underlying conditions. Investigations: FBC, film comment, B creatinine, LFTs, FBS, thyroid function test, skin snip and skin scrapings, and stool-RE. The main treatment objectives are to relieve symptoms and to identify and treat underlying disorders. Non-pharmacological treatment: avoid or minimize exposure to any identifiable causative agents, for example, soaps, detergents, drugs, clothes or fabric, also foods. And good personal hygiene, counseling for psychogenic pruritus. Pharmacological treatment: symptomatic treatment, you give hydrocortisone 1% topical, as you apply 12 hourly for 40 days, and cetirizine oral in adults 10 milligrams up daily for 7 days, and in children 7 to 18 years 10 milligrams daily for 7 days, 2 to 6 years 5 milligrams daily for 7 days, and less than 2 years the safety is not established. You can give chlorpheniramine oral in children less than 2 years 1 milligram 12 hourly for 5 days. And for the treatment of scabies, you give permethrin lotion 1% topical. In adults, you apply to whole body and wash off after 8 to 12 hours and repeat after 7 days. In children, apply to whole body and wash off after 8 to 12 hours and repeat after 7 days. And also, less than 2 months is not recommended. avoid contact with the mouth, and refer patients to the clinical pharmacist for counseling on the use of permethrin lotion, especially in children and for breastfeeding mothers. Also, you can prescribe benzoyl benzoate 25% solution topical. In adults, we apply over the whole body after a bath at night, except the face and head, and for 3 nights, and wash off the next morning. In children more than 2 years, 25% house strength dilution. You apply over the whole body after a bath at night, except the face and the head, for 3 nights, and wash off the next morning. Treat all contact cases in same manner simultaneously, and consult the clinical pharmacist for appropriate dilution and counseling on the use of benzoyl benzoate in children. Or you can use malathion 0.5% topical. You apply to the whole body, leave for 24 hours and wash off, and repeat application after 7 days. In children, you apply to the whole body, you leave for 24 hours and wash off, and repeat application after 7 days. Less than 6 months is not recommended. Clothing and bed lining must be changed and washed daily with strong disinfectant, and should be well dried and ironed or dry cleaned. Sexual and household contacts should be treated too. For the treatment of candidiasis, you give clotrimazole 1% topical. In other words, you apply to affected area 12 hourly for 14 days. In children, you apply to affected area 12 hourly for 14 days too. Or you can give miconazole 2% topical. In adults, you apply to affected area 12 hourly for 14 days. In children, you apply to affected area 12 hourly for 14 days too. For the treatment of liaria as heat rash or prickly heat, use calamine lotion topical. In adults, you apply 12 hourly for 7 days. In children, you apply 12 hourly for 7 days too. Or zinc oxide cream topical. In adults, you apply 12 hourly for 7 days. In children, you apply 12 hourly for 7 days too. For the treatment of atopic eczema, use aqueous cream topical. In adults and children, you apply as often as possible. Or aqueous soup topical. In adults and children, use as soup for bathing 12 hourly before applying the cream. Or you can use salicylic acid ointment topical. In adults and children, you apply as needed. For treatment of atopic eczema with acute flare-ups, use topical steroids in addition to what I mentioned for atopic eczema, and also hydrocortisone cream 1% topical. In adults and children, apply 2 to 4 times daily. For treatment of urticaria, use cetirizine oral. In adults, 10 milligrams daily for 7 days, and children 7 to 18 years, 10 milligrams daily for 7 days. 2 to 6 years, 5 milligrams daily for 7 days, and less than 2 years is not recommended. Or you can give clofeniramine oral. So clofeniramine oral in children less than 2 years, you give 1 milligram 12 hourly for 5 days. For the treatment of contact dermatitis, use hydrocortisone 1% topical cream. In adults and children, you apply 12 hourly for 14 days. And for insect bites like fleas, so bed bugs, you give cetirizine oral. In adults, 10 milligrams daily for 7 days. In children 7 to 18 years, 10 milligrams daily for 7 days. 2 to 6 years, 5 milligrams daily for 7 days. Less than 2 years, 2.5 milligrams daily for 7 days. Sources of infestation such as combs, hats, clothing, or bedding should be decontaminated by thorough washing, ironing, or fumigation. You can also give chlorpheniramine oral in children less than 2 years, 1 milligram 12 hourly for 5 days. For the treatment of pediculosis as lice, you give malathion 0.5 percent topical. In adults, you apply to the whole body and leave on for 24 hours and wash off. Repeat application after 7 days. In children, apply to whole body and leave on for 24 hours and wash off. A repeat application after 7 days. Less than 6 months is not recommended. A referral criteria: you refer to a dermatologist as soon as possible if diagnosis is unclear.